addiction. That was, so a question around, a bit of research and a bit of information online seems to jump out at parents around addiction with ADHD medication, particularly once our kids get to teenage years. What's your thoughts around that?
It's a really common question that we get, in the clinic. Will the stimulant medications increase the chances of, my kid or me having substance use issues later in life? And there's pretty good evidence that a good review in 2013 looked at that and said there was no evidence for increasing substance use issues, and if anything there may be a small protective effect. And more recently they've got these big population studies in Scandinavia, and they can look at people within the whole population for periods of time that they're on a stimulant versus times they're off a stimulant. And it seems that when people are taking stimulant medications for ADHD, their substance use rates are actually lower, which is kind of interesting, but you have to take those studies with a little bit of a grain of salt because it's population data, and people might be on medicine when they're coping better anyway. But it is interesting that it's kind of in the same direction, that if anything there's nothing in it, or possibly slight protective effect.
Yeah, right. I guess that makes sense because ADHD medication will just be making their day-to-day life.
Yeah, less stress.
Less stressful, which regulates that impulsivity that
people, self-medicating people.
Yeah,
Yeah.
That makes sense.
Yeah.
What impact does hormone change during the monthly cycle have on ADHD in women?
I've had a few reports from teenage girls that they feel like there are times during the period where symptoms are more apparent, and usually in the premenstrual kind of period. And I had to look it up, but estrogen is dopaminergic, which means that it kind of increases dopamine tone, which theoretically could be helpful. So times during your cycle where your estrogen's higher, it would make sense that things could be somewhat better during that period of time, but kind of worse at other times when estrogen's low. And progesterone may also have a bit of an impact, but it's early days in terms of disentangling some of these things.
Right.
And it looked like from the literature that people with ADHD have higher rates of premenstrual syndrome or premenstrual dysphoria,
Right.
which again is pretty interesting.
Yeah.